How to understand your LFT blood test results. Imagine getting a report that shows how well your liver is doing. Liver function tests are a set of blood tests that give doctors a snapshot of your liver's health. They measure different enzymes and substances that tell us if the liver is working properly or if there might be some damage. To understand your results, it helps to know what each test looks at and what changes might mean. The first key component is alanine transaminase, or ALT. This enzyme is mainly found in the liver. If your ALT levels are higher than normal, it usually means there's some injury or inflammation in your liver cells. Normal ALT levels are roughly between 7 and 55 units per liter. Elevated levels can happen with conditions like hepatitis, fatty liver disease, or even liver cancer. Next is aspartate transaminase, or AST. This enzyme is present in the liver but also in other tissues like your muscles and heart. Normal AST levels are about 8 to 48 units per liter. If AST is higher than ALT, especially if it's significantly elevated, it might suggest alcohol-related liver injury or other types of liver stress. Alkaline phosphatase, or ALP, is another enzyme measured in LFTs. It's related to the bile ducts, which carry bile from your liver to your intestines. Normal ALP levels are around 40 to 129 units per liter. When ALP is high, it might mean there's a blockage in the bile ducts or some cholestatic liver disease. Gamma-glutamyl-transferase, or GGT, is an enzyme that helps detect bile duct problems and alcohol-related liver issues. Its normal range is about 8 to 61 units per liter. Elevated GGT can support findings of bile duct issues or alcohol effects. Bilirubin is a substance produced when your red blood cells break down. Normally, total bilirubin is between 0.1 and 1.2 milligrams per deciliter. When bilirubin levels are high, it can cause jaundice, which is a yellowing of the skin and eyes. High bilirubin suggests your liver isn't processing waste properly. Albumin and total protein are measures of how well your liver produces proteins. Normal albumin levels are between 3.5 and 5 grams per deciliter. Low albumin can indicate chronic liver disease or liver cancer affecting the liver's ability to make proteins. Prothrombin time measures how long it takes your blood to clot. Since clotting factors are made in the liver, a prolonged prothrombin time can mean your liver's synthetic function is impaired. When your results come back slight elevations, less than twice the normal limit, may be temporary or mild. Your doctor might recommend retesting after some time to see if levels return to normal. Significant elevations, more than 2 or 3 times the normal, often need further investigation. Your healthcare provider will look at the pattern of abnormalities. For example, high ALT and AST suggest liver cell damage, which can be caused by hepatitis, fatty liver, or even liver cancer. Elevated ALP and GGT point toward issues with bile flow or bile duct blockage. Sometimes, you might see a mix of both patterns, which indicates a combination of liver cell injury and bile duct problems. It's important to interpret your LFT results in the context of your overall health. Factors like your medical history, symptoms, medications, alcohol use, and risk factors all play a role. For example, pregnancy can sometimes alter certain liver enzyme levels without indicating disease. Keep in mind that normal LFTs do not always rule out liver problems. Advanced liver damage may sometimes show normal enzyme levels, so your doctor will consider other tests and your clinical picture. After getting your results, reviewing previous tests can help identify trends. Discuss your results with your healthcare provider, who can explain what they mean for your liver health. If your results are abnormal, additional tests may be ordered, such as screening for viral hepatitis, autoimmune markers, or imaging studies like ultrasounds or CORT scans. Sometimes a liver biopsy is needed to get a definitive diagnosis. LFTs are especially useful in monitoring liver health over time and in detecting early signs of liver damage that could lead to more serious conditions like liver cancer. Regular testing helps catch problems early and guides treatment decisions. Managing liver health involves addressing the underlying cause, whether that's stopping alcohol use, treating viral infections, or managing other liver conditions. Remember, understanding your LFT results is a step toward taking care of your liver. Always consult with your healthcare professional to interpret your specific results and plan the right course of action. These tests are valuable tools, but they are just one part of a comprehensive approach to maintaining liver health and preventing serious liver conditions.